The human body is not a collection of isolated parts. It is a unified, complex system of levers, pulleys, and electrical conduits. Yet, modern medicine is built on a model of fragmentation. When you present with pain in your neck and shoulder, the system wants to categorize you. It wants to isolate your problem into a single CPT code, a neck problem, a shoulder problem, or perhaps a rotator cuff problem. But when you are the one living in pain, you know the truth. You don't have a neck problem or a shoulder problem, you have a movement problem. You have a systemic failure of the cervical-shoulder complex. Welcome, I am Dr. Padda. Today we are going to dissect the reality of the cervical-shoulder kinetic chain. We are going to look at why treating these areas in isolation is a failure of logic, and why we utilize a combined high-precision approach. We integrate both fluoroscopy and ultrasound to restore the terrain of your body. Let's begin with the anatomy of the failure. The cervical spine is the structural foundation for the head, but it is also the mechanical partner to the shoulder girdle. When your cervical facets, the zygapophyseal joints, begin to degenerate, you lose the ability to load bear effectively. It tightens the muscles. It restricts range of motion, but it does not stop at the neck. The shoulder begins to compensate. The shoulder, connected via the scapulothoracic joint and a complex web of musculature, begins to compensate. The rotator cuff works overtime to stabilize what the neck cannot support. The subacromial bursa becomes inflamed. The subacromial bursa becomes inflamed, not because it is the primary culprit, but because it is trapped in the middle of a mechanical battle. If you go to a typical pain clinic, they will offer you a cervical epidural for the neck pain, or perhaps a subacromial injection for the shoulder pain. They treat the symptom, they bill the code, and they send you out. They ignore the fact that the inflammation is a downstream effect. They treat the symptom, they bill the code, and they send you out. Treating one without the other is like changing a tire on a car that has a bent axle. At Regen.md, we practice a different philosophy. We treat the terrain, we look at the cervical spine and the shoulder structures as a single battlefield. We look at the cervical spine, the facets, the epidural space, and the shoulder structures, the bursa, the labrum, the rotator cuff, as a single integrated battlefield. And to win this battle, we need better weapons than the assembly line model provides. This brings us to the technological integration of our approach. The combined use of fluoroscopic and ultrasound guidance. Fluoroscopy is the gold standard for spinal intervention. When targeting cervical facets, we need the precision of real-time X-ray to visualize bone anatomy with absolute certainty. We need to visualize bone anatomy, dye flow, and depth with absolute certainty. You cannot compromise here. We need to see the needle in the joint space. If you are aiming for the cervical facet joint, you need to know exactly where that articular cartilage is. Fluoroscopy gives us that high contrast bony detail. But fluoroscopy has a limit. It is poor at visualizing soft tissue. It cannot see an inflamed bursa or micro tears in a rotator cuff tendon. This is where we pivot. We integrate ultrasound as a fundamental, non-negotiable tool in our arsenal. Ultrasound is the ultimate soft tissue microscope. It allows me to see the dynamic motion of the rotator cuff. It allows me to see the vascularity, the inflammation, and the real-time movement of your tissues. When we treat the shoulder, we are not blindly injecting a corticosteroid. We are identifying the specific site of tendinopathy with surgeon-like accuracy. So, why do we combine these? Because your pain is a combined problem. We are addressing multiple layers of the system. I might start under fluoroscopy to stabilize the cervical facet joints and clear the epidural space of inflammatory chemical mediators. This is the structural foundation. This is addressing the upstream mechanical issue. Once that foundation is addressed, we move to the ultrasound to address the downstream consequences. We clear the subacromial space, we address the bursa, we treat the rotator cuff. We are hitting every node of the pain generator in a single session. Now let's talk about what we are actually putting into these tissues. It is not magic, it is biology. We are moving away from dampening with steroids. Steroids have a place in acute inflammation, but they are catabolic. They break down tissue, they weaken the collagen, repeated injections accelerate the wear and tear. We use orthobiologics, specifically platelet-rich plasma or bone marrow concentrate, to trigger a regenerative cascade. These contain high concentrations of your own growth factors. When I deliver these into the facet joint or into the rotator cuff, I am essentially giving your body a signal. I am telling the tissue, It is time to repair. I am modulating the environment. I am shifting the terrain from a state of chronic catabolic inflammation to a state of anabolic repair. This is not about masking the signal. It is about fixing the biological environment that allowed the signal to manifest in the first place. I hear the argument from the insurance payers every day. They say, Dr. Padda, this is excessive. You are treating too many structures. My answer is simple. The body doesn't separate itself into CPT codes. If I treat your neck and ignore your shoulder, you will return in 6 months with the same pain. The insurance model wants to pay for a temporary patch. I want to pay for a permanent fix. This is why we built Regen.md. We are interested in clinical outcomes. We are interested in function. We want you back to the activities you love, not back in my waiting room. Let's break down the cervical shoulder complex further. The cervical facet joints are the most common source of chronic neck pain. These joints bear load. They have cartilage. They have a synovial lining. When they degenerate, they send a signal up the spine that radiates into the upper back and shoulder. This is what we call referred pain. If you treat the shoulder, but the source is the cervical facet, you have wasted your time. We prove the diagnosis. We use our fluoroscopic guidance to confirm the source of that pain through diagnostic blocks before we ever commit to a regenerative procedure. We don't guess. The epidural space is the home of the nerve roots. If you have a disc herniation, you have inflammatory chemicals surrounding the nerve root, a chemical radiculitis. This creates a hypersensitivity in the entire limb. It makes your shoulder feel like it is on fire. We clear that inflammatory soup with a guided injection. By performing a targeted, fluoroscopically guided epidural injection, we clear that inflammatory soup. We reset the nervous system. Then we move to the shoulder. The rotator cuff, specifically the supraspinatus, is the most common site of injury. Using ultrasound, I can see the footprint of that tendon on the humerus. I can see if there is a partial thickness tear. I can see the subacromial bursitis. I can treat these areas with microscopic precision. I can guide the orthobiologic agent directly into the site of the collagenous damage. We are doing a full system reset. When we combine these procedures, we are not just doing injections, we are doing a full system reset. We correlate everything to the pathology. I want you to understand the patient journey here. This is not a quick fix appointment. This is a comprehensive medical evaluation. We start with the patient's history. We look at their movement patterns. We look at their MRI data in conjunction with our physical exam. We correlate the symptoms. If the patient has cervical facet pain, we treat the facets. We do it because the pathology requires it. The data is increasingly clear. Regenerative medicine is not just an alternative to surgery. For many, it is the superior path. Surgery has its place for gross mechanical instability, but the vast majority of patients with chronic pain have a failure of maintenance. They have a failure of the body to heal itself. A chronic, low-grade inflammatory state keeps them in a cycle of pain. We are breaking that cycle. When I inject PRP into the cervical facets, I am seeing an improvement in the stability of the joint. We are forcing the repair. When I inject it into the rotator cuff, I am seeing an improvement in the thickness and quality of the tendon. This requires a level of diagnostic expertise. This requires a level of diagnostic and procedural expertise that is rarely found. Most clinics don't have a fluoroscopy suite or high-end ultrasound. Most physicians are either spine guys or joint guys. We have broken down that wall. We are system guys at Regen.md. If you are a patient, you have a choice. You can follow the assembly line. You can accept the steroid injections that weaken your tissue. Or you can take a look at the anatomy, you can look at the evidence, and you can demand a higher standard of care. Choose the terrain. You can choose to fix the underlying terrain. I see patients who have been to 5, 6, 7 specialists. They are tired and frustrated. They have been told it's just arthritis or just aging. I have a news flash. Aging does not have to be painful. Arthritis is modifiable. Stop treating it as a final destination and start treating it as a terrain to be managed. The blueprint for your body is still there. Your tissues still have the capacity to heal, provided you give them the right environment and the right signal. We are providing that signal. We are, in effect, performing a biological tune-up. We are clearing inflammation, stabilizing joints, repairing tendons, and resetting the nervous system. It is a comprehensive, holistic, and highly scientific approach. As we wrap up, I want you to reconsider what you think is possible for your body. Your pain is not a life sentence. It is a signal. My job is to read that signal, interpret it accurately, and intervene intelligently. Don't settle for the model that tries to put your complex anatomy into a simple box. Choose the model that respects the complexity of your biology. Choose the model that integrates the best technology. Choose the model that fixes the engine, not just the gauge. I am Dr. Padda. If you are ready to stop chasing symptoms and start rebuilding your foundation, we are ready to help you. Welcome to Regen.md.